Hi, this is Dr. Christina Hammer coming from Vibrancy VIP Med Clinic, coming today to talk to you about Botox injections. So, a lot of times people love to talk to me and ask me when they're in a consult, what is Botox and what is it made of? So a lot of times patients like to ask me, hey, I heard that I'm getting a toxin, which is a poison, into my face. And I like to correct that because I don't ever like to have people have misconceptions of what's actually being injected into their face. So what we're using is a small particle that actually comes from the botulism toxin, but what we put in our face is not toxic. It's just a small particle that binds to the ends of our acetylcholine receptors on our muscles. So that way, with our muscles, they usually like to contract after they release the acetylcholine. But when we have the toxin, it binds to it so it can't release the acetylcholine, and that way the muscle stays frozen and we don't have movement, so we don't have lines. So a lot of times patients like to ask me, why would I be getting Botox in the first place? Or maybe they've heard about Botox from commercials or even their friends or family. So I like to tell my patients when we're gonna be discussing Botox, it's for those fine lines and wrinkles on our face, from smiling, from age, as well as time. Maybe we've been in the sun. Here in New Mexico, we have a lot of sun exposure, which can definitely cause age spots as well as fine lines. What the Botox is good for is making those lines disappear and rewinding the hands of time. So a lot of times patients want to know, hey, what makes me a good candidate or not for our Botox? And I say, hey, the reason why we're doing a one-on-one consultation is because we just want to make sure we rule out any medical conditions such as MS, myasthenia gravis, ALS, such autoimmune conditions that can actually worsen the effects of Botox. That's a great question because it's important that you have it scheduled in your calendar as well as know how frequently we're going to have to be doing these treatments. Well, I tell people it's not permanent, which is great, as well as I tell patients it can range from anywhere from 3 months to 6, depending on how much we use our muscles. And each person is different. So a lot of times people want to know, hey, what factors may increase that use of Botox? Well, I tell people everybody has a different metabolism as well as rate. So a lot of times if we're exercising, having a high cardiac output, as well as if we use those muscles a lot, that's going to use the Botox quicker. A lot of times people will go, hey, I've had Botox at this place and I've used this many units. My friend uses this many units. How do we determine how many units of Botox that we're actually going to use? I say that's a great question, and that's why I like to do a one-on-one consultation, take pictures, and have patients look at their muscles as well as what do they want treated to determine how much Botox we're actually using at that time. Now, how I like to tell my patients is those effects are not going to be immediate. So it takes about 3 days to about 3 weeks for us to see the results of that Botox. A question that a lot of my patients say, all right, I've had my Botox today, when should I see you next? I do recommend having a follow-up already scheduled before you leave that appointment about 3 months later. So that way we can kind of see when those results are kind of minimizing and not use as much Botox because you still have a little bit of that Botox left. And yes, you are restricted on certain things such as exercise. I do tell my patients no exercise for 4 to 6 hours. Why? Because when I inject that Botox, I want it to stay right where I inject it, and I don't want any movement because any movement of that Botox injectable, it can cause such effects of dropping from where I actually initially put the Botox in the muscles, and that can cause effects of drooping of our eyes that we would not want. I do recommend about 2 weeks waiting for any other treatments such as peels, microneedling, lasers. Why is that? Because I really want to see those post-procedure pictures in 2 weeks. And if we do any other treatments, it may affect the results of the Botox that we just injected. Now, I do tell patients if we are treating our forehead or upper face with Botox, which is where we usually put the Botox, we can do Juvederm in the lips or the lower area where we're not actually injecting the Botox. Now, we do a fun treatment called the liquid facelift. People go, well, what is that? I love to tell them, well, liquid facelift is when we use Botox as well as Juvederm. I do like to use the Juvederm before I do the Botox, but it kind of lifts as well as fills in the spaces for where those wrinkles are caused and gives it a little bit of volume, as well as we're relaxing those muscles so we don't have the movement to cause those fine lines and wrinkles. These are questions and concerns that I really like to answer before we even do the treatment, so that way if anybody has any doubts of actually getting the Botox because they're worried about the side effects, I tell them, let's not do this until we are 100% in for the treatment. Some of those side effects can be drooping of the eyebrows, causing like a caveman appearance. Maybe that Botox moves, it can kind of cause drooping of that muscle, or it can affect a nerve, and we don't want that. I tell people you can sometimes get bleeding as well as bruising when we get the Botox. Why? Because we're putting a sharp object into our skin, and we can sometimes bust a blood vessel, which is not a bad thing. It's just it can cause bruising as well as bleeding, and we want to make sure that we don't get an infection, and that is why we clean properly before we even use an injection. And that is why we also give good post-care instructions to our patients, so that way they remember what to do and not to do after each treatment. So some of the things that we want to think about before even scheduling an appointment or a consult with myself or one of my staff members for treatment with Botox is looking at our calendars to make sure we don't have any events or special occasions where we're going to have pictures taken of ourselves, because like I said, one of the possible side effects is that bruising, and we don't want bruising in pictures. And remembering that those effects of the Botox are not instantaneously. It does take about 2 to 3 weeks for us to see optimal results. Now, because it takes about 2 to 3 weeks for us to see optimal results, I always make sure my patients have a follow-up after their first visit, 2 weeks from the time they had their first injection. You may say, why do I need to schedule so soon when you told me that Botox lasts from 3 months to 6? Well, after the first injection, like I said, it can take anywhere from 2 to 3 weeks to see optimal results of that Botox. Sometimes some muscle groups are stronger than the other, and we may need to inject more. So a lot of things that I tell my patient is I'd rather do less than more, because we can always add more, but I can't take out. And I'd rather add more so we don't cause drooping and see what those effects may be, as well as I like to save that dollar in your pocket. If you have any questions or concerns, please feel free to reach out to us with our contact information that's linked below. We hope that you got some great information with our video today. Please hit that like and subscribe button, and we look forward to seeing you next time. Bye.